Ever wondered how a patient with multiple medical conditions navigates their healthcare journey? Today, we delve into a complex case. A patient with a history of diabetes mellitus, positive PCR, deep vein thrombosis, held, ventricular arrhythmia, atrial fibrillation, pulmonary hypertension, obesity, coronary artery disease, and coronary artery bypass graft, who came to the hospital with leg cellulitis. The story begins with the patient noticing a painful red swollen area on their leg. As someone with diabetes, they knew the importance of seeking medical attention promptly. Unbeknownst to them, this was the beginning of a medical journey that would encompass many of their existing health conditions. Upon reaching the hospital, the patient was immediately admitted for the treatment of cellulitis, a common yet potentially serious bacterial skin infection. The doctors initiated antibiotics to combat the infection and began monitoring the patient closely, particularly given their extensive medical history. The patient's positive PCR result meant they were also battling an infection of a different kind. This required isolation protocols and additional treatment to manage and hopefully eliminate the infection. Their history of deep vein thrombosis and atrial fibrillation added another layer of complexity. Anticoagulation therapy was adjusted to ensure the patient's blood remained at an ideal consistency, reducing the risk of further blood clots while minimizing the risk of bleeding complications. The patient's pulmonary hypertension and coronary artery disease necessitated careful cardiac monitoring. Their heart was under strain from the infections, so the medical team worked to optimize cardiac function and alleviate the pressure on the patient's heart. Obesity, another key aspect of the patient's medical history, complicated their mobility and recovery. The team provided guidance on nutrition and physical activity, aiming to help the patient manage their weight and improve their overall health. The patient's past coronary artery bypass graft meant their heart had already been under surgical stress. This history was taken into account when planning treatment strategies, ensuring the patient's heart health remained a top priority. Over time, the patient's cellulitis improved, their PCR infection was managed, and their other medical conditions remained stable. It was a delicate balancing act, but one that the medical team navigated with skill and dedication. This journey underlines the importance of comprehensive, holistic care. Each of this patient's medical conditions influenced their overall health and their cellulitis treatment. The solutions provided were not just about treating the cellulitis or the PCR infection, but also about managing and stabilizing the patient's multiple medical conditions. So, remember, every patient's journey is unique, particularly those with multiple medical conditions. It's a complex interplay of various medical conditions, and managing them requires expertise, dedication, and a patient-centered approach. This patient's journey is a testament to the power of integrative care in managing complex medical conditions.